Coming up, we'll be on location at Chevy Chase Pediatric Dentistry in Chevy Chase, Maryland, discussing the benefits of pediatric dentistry and how they can help your child achieve a healthy and beautiful smile with one of this region's top pediatric dentists, Dr. Karen Benitez. Dr. Benitez received her DDS degree from the University of Missouri in Kansas City and completed her pediatric dentistry residency at St. Barnabas Hospital in New York City. Dr. Benitez is widely recognized as one of this region's leading pediatric dentists. Welcome, Dr. Benitez. It's a pleasure having you on our program.
Thank you. The pleasure is all ours.
It's your first time, in fact, on the Top Doctors interviews. We have some parents and wonderful kids that are going to be joining us a bit later, but I wanted to begin, if I may, Doctor, by asking you if you could please begin by telling us what pediatric dentistry is.
So pediatric dentistry is a continued 2 to 3 years of training in dentistry pertinent to children. So it's starting from infancy, when the baby teeth start coming through, when they start to change those baby teeth. Somewhere in there, sometimes we might discuss topics like injuries or habits of pacifier or thumb habit. And then to discuss further on the transition, maybe some orthodontic concerns, all the way through age 21 approximately.
Oh, that's certainly good to know. And the reason I ask that is a lot of folks out there watching right now may not realize the difference between, say, a general dentist and a pediatric dentist. And in fact, many parents take their kids to a general dentist, but there is a reason why it is so important for parents to take their children to a pediatric dentist. That's the additional training you just mentioned. I mean, that's what you specialize in, right? Yes. Dentistry for kids.
Yes. Exactly.
Now, I wanted to ask you if you could tell us the difference beyond the training component and the added years of education that you just mentioned that are required to be a pediatric dentist as opposed to a general dentist.
We both do have the shared dental background between general dentist and pediatric dentist, and then the pediatric dentistry took on 2 to 3 years of studies focused on the unique needs of children, their physiology and their development. But in the context that patients are more familiar with is that we are a group that is dedicated to all parts of the experience being focused solely on children. So it is almost like pediatric medicine just for children would be. The environment is designed to be engaging for children, comforting for children, something that they feel that is their space and they can just explore and learn without intimidations of what dentistry is. So it's an environment where we have a lot of toys, a lot of colors. Sometimes we speak in certain language that's more familiar with kids and just something that they can understand better. A lot of it is side by side with parents, a very close relationship that we have with the parent themselves in educating both the child on how to learn to do things themselves as well as the parent in being engaged caregiver.
I would say it's sort of like taking your child to a pediatrician instead of an internal medicine doctor.
Yes,
right?
The environment is just for kids, and we're fostering emotions that are also for children too.
Yes, and speaking of that, what you just described, my God, we have footage of your beautiful.
Energy.
Oh my God, this place is so beautiful. Toys, colors on the walls, all sorts of goodies that children would not just enjoy, they would love to come here and hang out here. And we're going to hear actually from some of those kids a bit later on that. My God, how things have changed since I was a child going to a dentist at that point.
I bet.
Now, I wanted to ask you, Dr. Benitez, what age is the right age based on your expertise from when a parent should take a child to a pediatric dentist? When should they start seeing a dentist?
We support the American Academy of Pediatric Dentistry, and that they say that children by first birthday should come, if not by 6 months after their first tooth has come through. And we support that because in all reality, it just helps us to catch things early, and we can instill prevention techniques. And all of that is just for overall better experiences for children.
Why is it so important as well, doctor, to begin seeing a dentist at an early age? And I know you just touched on that briefly on the prevention component, but I believe there are other important benefits as well.
So aside from prevention, most of it is just to comfort parents in their techniques and their brushing and diet. Sometimes injuries might be a reason that you might need a dentist early on if you haven't had one already.
What are some of the typical problems, the common problems that you see in children when it comes to their dental needs, doctor?
So most people know of a dentist in the thought process of cavities, but there are other aspects to dentistry. As I touched on before, growth and development is hugely important. That's why many pediatric dentists work strongly with orthodontic colleagues in the area. That way, as children are growing, we maintain their balance and make sure that they have prime occlusion, essentially. And so most of my primary concerns are cavity prevention, injury prevention, as well as growth and development.
And are there different treatment options for a child as they go, from that infant stage and toddler stage up into young adolescence that you have experienced and that you could educate the folks about?
Yes, so usually early on, things are more educational, less intervention. Most children, by the time they go to kindergarten, will have a cavity, and that's where you and I might discuss not just what a cavity is, but how are we going to do this? Most people question, how can my child sit still? And it's not about sitting still, but it's more about our relationship with your child and how we introduce next steps. We also do have what we call behavior management techniques. So a reward system, as you see behind me with all the toys. If you can see the prize at the end, then that is a huge benefit to a child. They've got it in their sights. Also showing them everything that I'm going to use, telling them what next steps are. Surprises are fun at a birthday party, but not in these elements. I use language that's familiar for children and can describe what they will be going through, but maybe not always sharing exact details. All of this is just in best interest of a child and gaining their trust in being able to complete the task. So I ask my parents to work with me, but sometimes we have a little conversation before about things that we'll just keep between us.
Yes, indeed. Well said. And when should kids begin using toothpaste? And I ask you that because we've had so many folks ask us that over the years. When should my child begin using toothpaste? So we have you here, a pediatric dentist, and I wanted to ask you if you could tell everybody, please.
I do encourage that you use fluoridated toothpaste. When you're young, under 3, you should be using just a grain of rice. Okay, so it's just a visual for you to understand the amount that you should put on the toothbrush. For parents who might have a little concern about a fluoride toothpaste, I do tell them at least use it at night in a very conservative manner. As you get older, I might introduce fluoride mouthwashes as well, okay? And a lot of times flossing, the word that no one wants to hear, but I do introduce flossing very early on.
Are there any other preventative measures that parents need to know who are watching right now that they can do on their end in addition to what you've mentioned?
Yes, I like for my parents to be fully engaged in hygiene at home, so children will always want to show you and make you proud of what they can do on their own, but I want for you to go in and follow up after. So a lot of times it's just a relationship where I teach the child and the parent how to work together cohesively. But most of this is what should we be eating, what should we be drinking, and then how should I brush my child's teeth and floss.
Yes, indeed. And how often do you recommend a parent bringing their child to a pediatric dentist? Are we looking at once a year, once every 6 months?
I say once every 6 months as well, yes. Keep it regular. On some, in some situations, I might recommend a more close sequence of 3 months, but that's only for select situations or high risk for cavities. But most of us will come every 6 months, see that you can keep something small and conservative.
We're now going to meet some parents of some of the patients of Dr. Benitez, and we're going to meet the kids too. Welcome, Connie and Jack and Dylan. It's a pleasure having you on our program.
Thank you.
Thank you.
I wanted to begin by asking all of you, the boys in particular, what's your experience been like thus far here at Dr. Benitez's dental practice?
I've thought it's been amazing.
That's great to hear from you. And what about you, Dylan?
I thought it'd been amazing, and I'm imagining right now what it is to get my teeth done by our friend.
All right, and so the boys are obviously very happy, Connie. They like their
Clearly.
experience.
Clearly, they have too much fun coming to the dentist.
And I must say, I think we mentioned this off camera, but how things have changed going to a pediatric dental office to when we were younger,
I know.
right? Over these
I
last
know.
several years.
I remember being a kid and being so scared going to the dentist and so
Exactly.
nervous, and it was always that kind of old, dungy, dark office.
That's
and when you walk in here, it's light, it's bright, it's airy. There's
right.
fun waiting for you around every corner.
And the kids actually want to hang out here, and they look forward to coming, right, boys? And that says a lot. I mean, look at you. You're running around playing with toys, having a good time, and getting your dental work done too, right?
Yeah.
Now, Connie, I wanted to ask you, when did you start bringing the boys to a pediatric dentist? What age?
We started with pediatric dentistry right at 2.
Okay.
And for this, you were going to say 2?
Yeah.
That's good. For the first checkup. And, that's, of course, when you hear that you need to be doing all the things that you're not doing yet,
That's
like
right.
flossing and using, what is that stuff we use at night?
Fluoride.
Fluoride. So, and it was just a natural to switch to Chevy Chase Pediatric Dentistry when it opened up.
And obviously the boys are very happy here. And is there anything else you all would like to tell all the other folks watching before we let you go?
I would say come give Dr. Benitez a shot, because she is warm, welcoming, and makes the dentist experience just a comfortable one.
Yes, and that is so important that they experience that right from the get-go by having positive experiences, and in this case, fun experiences. They're going to always look at the dentist as somebody that they want to go to as opposed to they have to go to.
That's just it.
Yes, and
It's
boys, anything you'd like to say before we let you two go as well?
I have something that I really like her office, Dr. Benitez, and I would really like to go here.
Oh, well, you already do, and we're happy you do. And what about you, Jack? Anything you'd like to say as well?
I'm ready for my next tooth.
So on that note, I'd like to thank you, Connie, Jack,
Thank you,
and
Rocco.
Dylan, for joining us and being guests on our program. It was our pleasure.
You're welcome.
Thank you.
Welcome, Emily,
Thanks.
and welcome, Doc. How are you both?
Good.
All right. And how old is Doc, Emily?
Doc is 3 years old.
3 years old, my goodness. And what's the experience been like for him, and both of you for that matter, bringing him here to Dr. Benitez's practice?
We have been so pleased with Dr. Benitez's practice. The space is gorgeous. The colors are really welcoming and calming, and Dr. Benitez is, she has a way with kids for sure, a calming demeanor, and we've been really, really happy.
Well, I'm certainly happy to hear that.
Yeah.
It's always important, as we just mentioned in the previous interview segment with Connie and her 2 boys, about the importance of kids from their very first experience, right, at 2, 3 years old, moving
right.
forward, to have a positive, fun experience coming to the dentist.
That's right.
Because
Tickle
then
their teeth.
Yes, that sets their whole framework, the way they need to be mentally and the way they look at dentists in the positive manner, because it's very important to go to a dentist on a regular basis.
That's right.
And now let me ask you, Doc, how are you doing, young man?
Good.
Good. Do you have fun when you come here?
Yeah.
All right. And before we let you go, Connie, can you please tell us of what the staff has been like here as well, as far as scheduling appointments?
Great. We have had a really, really tremendous experience. And the staff has been great, very welcoming, very prompt to respond. And Dr. Benitez, she comes super highly recommended. She's a longtime practicing pediatric dentist, and that matters to us. And we've had such a wonderful experience being here.
Well, on that note, we'd like to thank you both, Emily
you.
and Doc, for joining us and being guests on our program.
Thanks so much.
All right. And Doc, bye-bye. We're now back with Dr. Benitez. I must say, not only were the parents very happy with their experience for their kids thus far, but the kids love it here. I mean, look at Jack and Dylan and Doc, who we just heard from, little boys, and they are actually enjoying themselves. Heck, they're still playing out there right now. They haven't even left, even though their part of the interview was over a while back.
Good, good.
It says a lot about your practice and the fun environment you've created for them.
Thank you.
Now, we're literally out of time, Dr. Benitez, but I wanted to ask you before I let you go, you and your practice, Chevy Chase Pediatric Dentistry here in Chevy Chase, Maryland, have certainly established a reputation for excellence. Not only do the kids love it here, but the results that the parents are seeing, the fun the kids are having. It is so important for people, as I mentioned briefly earlier with one of the parents, that it's important for the child to experience a positive experience, a fun experience, as far as when they first begin going to a dentist, so they stick with the dentist for life instead of the opposite happening.
Running away.
Yeah, so I wanted to just ask you what you feel helps separate you and your practice apart from many of the others.
I think in our practice here, what we strive to achieve is a close relationship with parents and children. We are a practice in which parents are present in all treatment areas, and your children are treated just like we expect for our own or our families. So we're here to educate you in a very respectful manner and have you be an engaged member of this. Our children feel familiar for a reason. We talk on their level, eye to eye, and this is what they expect and what they appreciate as little people as well.
Yes, indeed, and then they're happy and they stay with you all the way through adolescence and enjoy going to a dentist moving forward, which is so
Sadly,
important.
yes. Yes.
Well, on that note, we'd like to thank you, Dr. Benitez, for educating everyone here and being a guest on our program. It was certainly our pleasure having you on.
Thank you so much.